Hi, my name's Andrew. I'm going to go ahead and present my patient today. So I have James. He's a 20-year-old. He came to the clinic by himself today, and he is a reliable historian. So James presents to the clinic today with right third distal phalanx pain after following a crush injury. So what happened was this morning rather, he was playing the piano and he went to close the lid and it actually crushed his finger, the end of his right middle finger. Um, so he immediately had pain. He iced it. He waited for a little while. He waited about 2 hours and he took 600 milligrams of ibuprofen and he was able to obtain some relief with that. Now he rates the pain as a 7 out of 10. He says that it's constant, it's throbbing, and sharp intermittently. In the last 2 hours, he's felt increased numbness to the area, but he does not report any changes in strength, or he reports no weakness, I should say. Um, he has no history of prior fractures or injury to the area, and during the closing of the piano lid, he says that nothing else was hurt while that happened. So his adult medical history, there is nothing relevant there. For his health maintenance, his immunizations are all up to date, including tetanus. The only medication, or over-the-counter, I should say, that he takes is a multivitamin. He is allergic to Tylenol. He gets some mild throat swelling with that. As far as social history, both of his parents are alive and well. He has 3 sisters that are also alive and well. His social history, or that was his family history, excuse me. His social history is unremarkable except for the fact that he is a non-smoker. His occupation is a trash collector, so he does need to use his hands quite often on the job. He's also very active, and like I said, one of his hobbies is playing the piano. In his review of systems, everything was unremarkable except for he did say there was some swelling and pain in that third right digit on his hand. He also claimed there was some numbness, and then along with the numbness, swelling, he said there was bruising as well, but he didn't say that the skin was broken or anything like that. His vitals were all within normal limits, very unremarkable there. For the physical exam, general, he's well-groomed, well-dressed. He appears to be in not much distress, and he's handling the pain appropriately. His head, ears, and throat exam came back totally normal. His neck was supple, no vision changes, nothing wrong with his ears or anything like that. As far as the cardiac exam, no palpitations, no tenderness. Upon palpation of that, normal heart sounds heard. For the lungs, I was able to auscultate clearly at all lung bases, so that was great. Musculoskeletal tenderness and swelling at the third right distal phalanx. Slightly decreased range of motion, likely secondary to this pain and swelling. He was able to extend his PIP and MCP joints of the third digit, and along with all other digits of the right hand and the left hand. When we compared range of motion, with the wrist, he was able to extend and flex on both sides. And then for the neurological exam, on physical exam, there was some numbness to that right distal phalanx when compared to the left side, and there was normal sensation at the base of the right digit, as well as all other fingers on the right hand, as well as the left hand. His skin was intact. I did notice some ecchymosis and erythema on the right distal phalanx, but otherwise there was good capillary refill. Everything was all intact there. So today we decided to go ahead and do an x-ray of the finger, and per radiology the impression was a closed non-displaced fracture of the third distal phalanx of the right hand. So the differential diagnosis included a fracture of that third distal phalanx. It included a finger sprain and also a tendon rupture. X-ray did confirm the non-displaced fracture of the third distal phalanx on the right hand. So we went ahead and gave the patient an aluminum foam cap splint. We educated him on rice. We told him to follow up in 4 to 6 weeks for a recheck on x-ray, and to return sooner if he noticed any pain or swelling, or increased swelling, I should say. We also discussed that he could take up to 800 milligrams of ibuprofen daily for the pain. The patient understood the plan and agreed with it.